Doctor, you suggested that as a result of your years of professional experience, we can place more confidence in your professional opinions, correct?
Yes.
And your position in this regard also assumes that experienced professionals have acquired greater skill and expertise compared to less experienced professionals, correct?
Yes, I think that's rather self-evident.
Well, let me ask you this. If accumulated experience were consistently associated with greater expertise, professionals would acquire that expertise as a result of their learning experiences, correct?
Right.
And learning in response to experience necessitates feedback in response to your professional work, correct?
Right.
Feedback allows professionals to recognize their errors and then correct them, correct?
Yes.
Have you ever published any articles in a peer-reviewed journal?
No, that's not consistent with the focus on my treatment work.
Peer review would afford you systematic feedback about what you think and say as a professional, correct?
I imagine it would, yes.
But you have never sought the feedback associated with submitting an article to a peer-reviewed journal, correct?
No.
In your treatment work, you do not regularly videotape or audio tape therapy sessions, correct?
No, I don't know who does.
And without videotaping your therapy sessions, it's quite difficult to obtain objective feedback from a colleague regarding your treatment process, correct?
Well, I can discuss cases with colleagues.
But without a videotape of what actually occurred, it's quite difficult to obtain feedback from your colleagues about your treatment work, correct?
Oh, now I see what you're getting at, that the colleague can't see the session. Yes, that's correct.
Because there's a world of difference between discussing therapy with a colleague and a colleague actually seeing a videotape of what occurred, correct?
There can be differences, yes.
Do you videotape the interviews and psychological testing you do in the course of your evaluations?
No, I don't know who does that.
Without videotaping your therapy sessions or evaluative interviews, you could be committing errors and never even know it, correct?
In theory, that's possible.
And you could remain unaware of your errors because there's no objective feedback to you regarding what you do as a professional, correct?
In theory, again, that's possible.
And without objective feedback, you could continue committing the same kind of errors over and over again, correct?
That could happen.
The Journal of Professional Psychology Research and Practice is a generally accepted peer-reviewed journal in your field, correct?
Correct.
And a 1996 article by Garb published in the Journal of Professional Psychology Research and Practice entitled The Representativeness and Past Behavior Heuristics in Clinical Judgment might be relevant to your opinions in this case, correct?
Might be, yes.
Now, please consider comments from Garb's 1996 article, and I'll quote. Clinicians frequently have trouble learning from their experience in the clinical settings, in part because they do not always receive accurate feedback, especially with regard to diagnosis. Now my question. If clinicians frequently have trouble learning from their experiences in clinical settings, your claims of expertise based on your clinical experience might warrant skepticism, correct?
If those problems are the case, yes.
You have not published anything in a peer-reviewed journal necessitating we reconsider Garb's position in this regard, correct?
No, I have not.
And you cannot cite anything in a published peer-reviewed journal article necessitating that we reconsider Garb's position in this regard, correct?
No, right off the top of my head, no.
And so without peer-reviewed articles demonstrating the contrary, your profession generally recognizes and accepts that clinicians frequently encounter problems learning from their experience in clinical settings, correct?
It seems that someone could take that position.